Tear trough is thin skin, orbicularis, and bone. Okay? So when you are injecting there, you're basically injecting either in top of the bone, is supra-periosteal treatment. If you're starting, that's where you should do it. Or you're doing supramuscular treatment, okay? Which is always below the skin, never in the skin, okay? If you do deep injections, I mean, you're safe, but you have to use more product, okay? If you use a more superficial injection, like we were talking before, you use less product and you correct more.
Also here you inject the superficial. No, here no.
But here is different because she's not a patient with a real tear trough, this patient. This is something.
It's not a real tear.
No, this is something different.
It's a depression of malar eminence depression.
Yeah, exactly.
It's not a tear trough. It's not a real tear trough.
No. So this is actually a patient with a congenital because she's young.
What do you mean when you say tear trough? Because the first one who spoke about tear trough was Robert Flowers.
Flowers and Loeb.
Yes,
and
was
Loeb.
the first. Yes.
Nasojugal fall, Loeb, and Flowers tear trough.
Yes.
The same.
And he described a sulcus going from the inner part of the palpebral region, crossing the zygoma toward the lower part or the middle part of the face, just crossing exactly in the middle the zygomatic region. So I think that is properly described as a tear trough. The frontal part.
As we discussed today for filler, tear trough goes around the orbit,
Yes.
not inferior.
Yes. But the real description of tear trough is this one.
Yeah, because when they were talking about tear trough, Loeb and then Flowers, they were using the terms because
For two different things.
back then, what they were advocating were orbital rims or Baylor implants, silicone implants. So they have to cover the inferior area. But now that we are talking about fillers, specifically hyaluronic acid, we are talking about in young patients. You have to think about the type of patients that are going to see you in the office for tear trough or nasojugal fall or
Nasojugal fall. Yeah.
Are young patients less than 40 years old or between 40s and 50s with good skin tone, and those are the ideal patients to take the fold. Because in older patients, 60 years old, probably, or not good skin tone, probably you are better off with a fat reposition procedure if you're doing lower lip blepharoplasty. So what I do in the young patient population is that I use almost always for the tear trough hyaluronic acid, and I do direct injection at the tear trough, and I do a combination injection of deep over bone, advancing from the more distal to the more medial, up close to the medial canthus, you will see. And then, if I need to, I go a little bit more superficial over the orbicularis muscle, but with very tiny, it's like a sandwich, you're doing it like a sandwich, okay, just to correct. But if you are starting to do that area, it's better to always go over bone. And it's very easy because you're touching bone.